So, are you someone who is suffering with low back pain and your low back pain is in the radiating to your buttocks, and then when you try to get up from sitting position, it becomes really, really painful? So this could be because of sacroiliac joint pain. Usually this happens in middle-aged females and post-pregnancy, after you have given birth or after your delivery, you feel that the pain is there in the back, which is radiating to your buttocks or sometimes to your thighs, and then when you try to get up, it becomes very, very, very painful. So that is because of a sacroiliac joint pain. This is called a sacroiliitis. So what is sacroiliac joint? So our spine and our pelvis is in connection, and the connection is through this joint. So this is sacrum, this is your pelvic bone. So these two joints will combine and make a sacroiliac joint. Now what is the role of the sacroiliac joint? The entire pressure or the force that is generated by your spine is transferred into the pelvis or distributed into the pelvis. This happens via this joint. So the role of this sacroiliac joint is to balance the pressure between the spine and distribute it to the pelvis. So now when this joint is at strain, what are the reasons that it could be at strain is because after you had any injury or you had any trauma, like you have fell down on your buttocks, then this could be into a state of strain. You have given delivery, you have your pelvis is stretched and it is overstrained and it has not come back to the normal level. That is another cause. Because of age, a degenerative condition is very, very important. Because of few conditions like ankylosing spondylitis or inflammatory spondyloarthropathies, which are the common cause of causing this kind of pain in young patients. So these are the common causes where there is a strain at the sacroiliac joint, and because of that you will start having low back pain. 30 to 40% population suffers with sacroiliac joint, and it is one of the most common reason where the diagnosis could not be made. That is, it is one of the hidden cause of low back pain. So if you have this, please refer yourself to a physician who can make certain tests and diagnose this sacroiliac joint pain. Now, how do we diagnose this? So the first very important thing is to do a physical examination. So your doctor will do certain examination physically, and these are called as provocative tests. So certain movements which will put strain on the joint, and they will try to elicit the same pain. So once that test is positive, again, if required, a CT scan or an X-ray or an MRI can help. But the most diagnostic way of diagnosing this is by doing a local anesthesia injection. So by clinically, if your physician thinks that it's a sacroiliac joint pain, they can put you for a diagnostic block. So how the diagnostic block is done is under fluoroscopic machine. They will just put some local anesthesia into your sacroiliac joint, and if your pain has reduced, then the diagnosis of sacroiliac joint can be confirmed. Now, once this pain has been confirmed, how are you going to treat it? So the first very important thing is applying a holistic or a multidisciplinary pain management system. How we do that is we put you on some physical therapy. Now sometimes there is role of IFT therapy, ultrasonic therapy, dry needling can initially work. If these things are working for you, you may opt for certain exercises and some anti-inflammatory, and you can try this. Otherwise, if this is not working, then we have to go to another level of treatment, and that is doing a sacroiliac joint injection. So under the fluoroscopic guidance, just like the local anesthesia was injected, we can do a sacroiliac joint injection followed by radiofrequency ablation of the joint. And finally, we have other treatments like platelet-rich plasma therapy for regenerating the joint. Then there are literature where Botox is helping for sacroiliac joint pain. So these are very commonly done procedures which are done as a daycare, and very simple technique by using small needles. Because sacroiliac joint pain again is very, very difficult to treat. Only physical therapy is not going to help you. So applying a multimodal approach with physical therapy, then using some anti-inflammatories, and then opting for such kind of needle injection procedures followed by a good rehab is going to holistically take care of your sacroiliac joint pain. So if you are one among those suffering with this kind of pain, do not miss to see your physician so that they can diagnose you and treat you adequately. Thank you.